For our next session, which is enhancing the educational experience, we have a substitution. Fred Shaw is sick, although I guess okay, basically, but sick. And in his place, very kindly, we have Stephen Jones as a moderator. He's the associate editor of Public Health Reports, and he's a public health consultant epidemiologist who retired from the CDC in 2003. He's worked on successful smallpox programs in India, Somalia, and what was the third one? Bangladesh. And he's worked for 30 years on drug user issues. Steve, thank you for coming.
Thank you. The panel should certainly come on up. I got a call from Fred about 4 days ago saying he wasn't doing well, and could I take his place, and I'm hoping to do that, and I hope I do it as well as he would. I just want to say the last two panels were quite extraordinary, and we're going to do even better. So we're talking about enhancing the educational experience, and the first speaker is Greg Evans, talking about teaching support, training, and supporting teaching assistants. And Greg is an environmental epidemiologist and dean and professor of Georgia Southern University Jiann-Ping Shu, I hope I got it right, College of Public Health.
Thank you.
Sure.
Yeah, it's going to be hard matching the last two sessions. I found them extremely interesting, and it's more difficult talking about graduate assistants and making it exciting. First thing I do want to acknowledge is my co-author on the book chapter, which is Rachel Schwartz, who also happens to be my wife, who also wrote most of the chapter, although I get the credit for it because I become first author, I guess because I'm dean, and it comes out that way. The other thing that is important is that it's a learning environment. And what I've learned is that my slides won't help. And given that, I'm not going to use my slides, being a learning environment. We're talking about graduate assistants. People, use different terms for them. We're going to use the terms here, TA1 for those assistants that really are not having total responsibility for a class, but are helping an instructor with that class, and TA2s, which actually at that point really does have primary responsibility for a class. We find that there's benefits of graduate assistants, both to the graduate programs and to the undergraduate programs, at least at our university. I also find that it's a constant ongoing process of how you can best train graduate assistants. And I talk a little bit here about what we attempt to do, but in reality I realize we still don't do that good a job. And we're going to have to do much better in our university. And I'm certain there's universities out there that do a better job, and probably some that do a lesser job than what we do. The graduate assistants are not just those people who are in there to help you out in the classroom or to teach a course. Particularly in situations where many of these graduate assistants are teaching undergraduate courses, at least in our place. And I look at this and I'd say, boy, you really want some of the best people you could possibly get in that classroom, because they're really recruiters also for your graduate program. And if you have graduate assistants teaching these courses and they really are not at the quality to really interest the students into the program, that's going to do a disservice to your program. So I find that is very important. But graduate assistants also, they bring a content into the classroom that might be different than the professor, because usually they're much younger. They've had different experiences than we've had as professors, where we've been doing this for a large number of years and might bring some perspectives that are dated. They frequently have a strong connection to the students, so they understand the students. They understand what the students need. They also have a good understanding of the new technology, which many of us do not have as good of a grasp of, and can bring this into the classroom also, and can understand when the students talk about this. The graduate assistants, they gain also professionally from this. They gain from the experience of being in front of a class, of actually teaching a class. They gain the experience and the confidence that you gain from being in front of a class of a number of actually your peers. And you gain this confidence, you gain the communication abilities, you gain all of these types of things. You also are basically preparing yourself for that next step. And that next step is that you're going to go on to be a professor. And what I have found so often is that what we're trying to do is we're trying to get these graduate assistants at a different level than what we were. I mean, when I came into the classroom the first time, what did I do? I did what the professor that taught me did, and that professor probably did what the professor that taught them did, and you don't bring in anything new. Well, what we're trying to do with the graduate assistants now is really be able to teach them the best that we can possibly do in terms of new teaching abilities. So the graduate student, the graduate instructor in their first semester are basically just learning. You basically are working with them, you're mentoring them, you're sending them off to whatever you have at that university in terms of offices for teaching and learning, so that they can come and learn the most that they possibly can during that first semester as a TA1. They might do some interactions with you as a professor, but they're probably not going to do a lot beyond that. Certainly in their second semester, they'll take a little bit more responsibility. And that responsibility, they'll help with the lessons plans, probably do grading of multiple choice questions and so forth. But what they are doing, you're trying to bring them up. You're trying to teach them. You're trying to help them. You're trying to send them out to work with others. You're trying to ask them to come in and go to other professors' classes, see how they do it. You're trying to also then bring maybe some peers in to give them more insight in what they're doing. You're preparing them for that second year in which they're graduate assistants twos, in which now they're at the point that they are going to be teaching their first introductory course, that introductory course to undergraduate students. And they're going to be teaching this, and they're at the same time are going to continuing this learning process. They need to have much access as possible to other instructors, to other teaching methods, to what your university can bring in. And some universities have more that they can bring in than others, and some have less. What they're prepared then, certainly by their last semester, they're really at a point where hopefully they will be able to teach an upper level course, bring in everything that they've learned up to this point, and be able to do the best in the classroom that's possible. Thank you. I'll tell you, that thing is a little scary, you know, that timer, you know.
That's the whole point. And thank you for keeping to 7 minutes, which is
It's not easy.
it's a major challenge, I agree. So the next topic is teaching with technology, and Wayne LaMorte is going to speak on that topic. He's a physician who also has a PhD in biochemistry and an MPH from Boston University, and he's been here in Boston University for a mere 30 years.
I was sitting on the stage looking at the timer. It was even freaking me out. Technology's actually contributed to teaching for quite some time. This class took place centuries ago, but There are perhaps some elements here that are familiar to you, including students who display varying degrees of engagement. These students did not have textbooks. This is like 1390, but they did have the ability to take notes. The printing press, which was invented probably about 50 years after this in 1440, was obviously a major technological innovation for teaching. And one of the problems, though, was that there still really was not an easy way to display images in the classroom. This was partially solved with the introduction of blackboards around 1800, as demonstrated by these anatomy drawings in a class in the School of Public Health in about the mid-1880s. And lectures continue to play a major role in teaching, and chalkboards continue to be used, although they're slowly being replaced by whiteboards and PowerPoint presentations. We have a lot to learn about teaching and learning, but one thing that is abundantly clear from today's discussion is that students need to be actively involved in learning. And L.D. Fink makes a case for designing courses in a segmental way that coordinates learning activities before, during, and after class. So, pre-class activities that provide content in a clear, engaging way make it possible to rethink how class time is actually used. And instead of giving a straight lecture for several hours, a class might be broken up into a series of mini lectures which are interspersed with opportunities for active learning exercises. So I think of teaching technologies just as a set of tools that can facilitate this. Obviously, small seminar classes with a lot of active discussion don't require a lot of technology. But there are many courses, and particularly core courses, for which thoughtful use of technology can enhance clarity and engagement. And I'd like to comment on just a few of the tools that I've found particularly useful. PowerPoint gets a bad rap because it's often abused by just reading slide after slide of bullet points. This is obviously not optimal, but the visual component of learning is clearly important, and PowerPoint can be useful for illustrating concepts. This is actually a slide in a brief series of slides in which I'm comparing strategies for sampling and also how to summarize data with contingency tables. This is a video segment from Inside Edition which suggested that a rare neurological complication in this cheerleader over on your right was triggered by getting a flu shot. And so I embedded this short video clip into a PowerPoint for my first class in an epidemiology class several years ago. And it sparked a very lively 45-minute discussion which included things like the quality of evidence, causal inference, bias, random error. And so it framed many of the topics and the issues that we were going to cover during the course, and it also underscored their relevance. A number of years ago, I began creating online learning modules with a user-friendly software package that allowed me to integrate text, images, videos, and intermittent quiz questions and learning activities into web pages that were highly accessible and easy to navigate. And these have become extremely popular with the students. This next slide is just the first page of a module on measures of association. Each of the pages in the modules has a link to a contents page that provides hyperlinks to every single topic within the module, making it very easy for the students to get to a specific topic and to navigate. Embedded self-test questions like this one make the modules more interactive, and they also give the students a way to kind of gauge their understanding as they work through any of the modules. The same software was used to create a semester-long interdisciplinary case based on efforts to improve the health in a Massachusetts community. This page here invites the students to use Google Earth to explore the community in order to get a better sense of the built environment and the challenges that it presents to increasing physical activity in the community. Years ago, my students completed hard copy problem sets after each class and then turned them in the following week. The TA and I would then begin grading them and writing feedback that became shorter and shorter after having graded about 10 of them. And then we would hand them back the week after that. So basically, there was little feedback, and it was delivered 2 weeks too late. So I then began using online quizzes in Blackboard that provided automatic scoring and much more detailed feedback. And there are a variety of question types, as you probably know, that are available in Blackboard. And one of the ones that I've used, heavily relied on in the quantitative courses that I teach, is the calculated numeric, in which the student actually does the calculation and inputs a number rather than simply using multiple choice questions. So this was fairly successful, and I then built on this by creating large pools of questions for each of the topic areas in the course. And I created then, once the pools were created, I created quizzes that randomly selected 10 questions from an appropriate pool. The students had to complete one of these quizzes in the week following a given class discussion, but they then were allowed to retake the quiz an unlimited number of times, each time receiving 10 questions drawn at random from the pool. I used the highest score that they had achieved on each quiz as part of their semester grade as a way to provide an incentive for them to review their mistakes and to increase their understanding and correct any deficiencies. So this slide shows all of the quiz attempts of a single student in all 11 quizzes that were given in my epidemiology course several years ago. In here, I don't know if it projects particularly well, but I alternated blue and red simply to distinguish one quiz from another. You'll note that this student took each quiz multiple times. Some of her initial attempts were very low score. It resulted in very low scores. But she persisted and took the quiz over and over until she had achieved a score of at least 95% on each one. And I would think that on average, students this semester took the quizzes probably on average about 4 to 6 times, although some of them were quite many more than that. And finally, every once in a while, we get a snowstorm that requires canceling classes and rescheduling. An alternative to this would be to use web conferencing software in order to conduct the class online. This shows it's a screen grab showing the use of Zoom web conferencing software. With this software, I can annotate the screen, I can create polling questions, I can actually even set up breakout sessions so that students can go to their breakout session and have individual discussions online, and I can record the whole thing and then later on post it on Blackboard. And I've found that while students and I much prefer to have a face-to-face classroom, this is actually an attractive alternative. They greatly appreciate not having to travel during snowstorms and not having to reschedule classes. And this has also turned out to be a very useful technology for doing help sessions, either with groups of students or one-on-one. So in summary, technology is not a panacea. It's really, I just think of it as a set of tools that are available to facilitate learning and to help your students achieve their learning objectives. And I'll stop there, and I'm out of time.
Thank you. The next topic is on evaluating and valuing public health teaching, the challenge of course evaluations. And Delia Lang is a research associate professor, behavioral science is in health education at Rollins School of Public Health at Emory in Atlanta. And go ahead.
Thank you. And I realize that I'm the only thing that stands between you and lunch. So I'm committed to the 7 minutes. First, I want to acknowledge Dr. Liz Walker, who's here in the audience, who's my co-author and my colleague. And so when we were asked to contribute this chapter to the book, I thought, how hard can it be to talk about student evaluations? We all have a relationship with them of one sort or another, until I dug into the literature and realized that there's probably more than around 80 years of literature documented in this area, so that was a little daunting. But essentially what we know, and I'll use the term student ratings going forward, is that it's frequently utilized across all disciplines. It informs undergraduate and graduate teaching in programs. There is a great deal of conflict around findings pertaining to reliability, validity, and use of these ratings. Where there is some agreement is that they are necessary but insufficient to really address the needs of the multiple constituents that they serve. And so who are these constituents and how are student ratings used? In the past, primarily they were used by students to help select courses or get a better understanding of course content and instructor selection. Faculty may use them for formative purposes to improve course their teaching in the course or the course structure. That, of course, depends on how much faculty believe in course evaluations. And ultimately, the last group, the administrators use them for summative purposes. This is for performance evaluations, for hiring, as well as for documenting teaching and assessment of learning outcomes for accrediting bodies, as we all know. And so right now, actually, currently, the primary use of students' ratings is for summative purposes. And those who are proponents of using ratings for this purpose suggest that really students are in the best position to offer perceptions about their instructors, as well as to evaluate the degree to which they've learned under an instructor in a course. And dissenters of this view suggest that actually students may not be as motivated to really give thoughtful feedback to student ratings, because they typically happen at the end of the semester when they're quite busy, and also they don't necessarily help them in the future, since the course that they're evaluating has now come to an end. Other issues we have heard from the panel, from the previous panel, other issues with student ratings include bias based on gender or race, ethnicity of the instructor, as well as influences from other factors unrelated to teaching effectiveness, such as academic discipline, class level, class size, required versus elective courses, and so on. So while there is agreement that these assessments might be useful, there's also the sense that they need to capture a multidimensional facet of what teaching effectiveness actually is. And there's no agreement, however, on what those multiple dimensions are, and that's where the issues lies. For summative purposes, the literature suggests that administrators focus on one global score, and there's many of those administrators in the room today, so I'll let you judge whether that's true in your particular setting or not. So the other concerns rise from mixed results regarding validity and reliability. So are they valid? Are they reliable? There are some reliable measures out there, but literature suggests that really in-house instruments are most often used, and they don't go through a rigorous psychometric evaluation. The validity part is where it gets a little bit more concerning. A lot of the literature in the 80s, particularly Cohen in 1981, conducted a massive meta-analysis that suggested a correlation of 0.43 between teaching effectiveness and learning outcomes. And just last year, as we were working on this chapter, a new article came out by Udall et al. From Canada, I believe, and they reanalyzed the very same studies that Cohen did and found a correlation of 0 after they controlled for some factors that the previous authors didn't control for. Udall kindly calls the other authors voodoo statistics, and in their conclusion, they suggest the following, and I quote, "Universities and colleges focused on student learning may need to give minimal or no weight to student ratings. Universities and colleges focused on students' perceptions or satisfaction rather than learning may need to terminate all faculty members who do not exceed the average ratings by the department of the university, despite common sense objections that not every faculty member can be above average. So the question then is, do we just throw out the baby with the bathwater, or what do we do? And so this idea of a holistic approach also is not a new one. This holistic approach looks at other ways to assess teaching effectiveness, where it retains student evaluations and feedback, both in terms of traditional student ratings that we may already have, but suggests other measures as well, such as student group instructional diagnosis. This is where an external faculty member may come to your course either mid or end term and really elicit a discussion from students, not as much as a focus group, although that is also an option, but just more of a qualitative discussion around strength and weaknesses of the course, and feeds that information back to the instructor. Peer feedback and peer observations of having peer faculty or teaching experts come to the classroom to observe teaching and give feedback has also been proposed as a way to get at teaching effectiveness. Of course, all of these have their own drawbacks. Some of the qualitative ways of addressing this, they're very time-consuming and take away from class time or content. The peer feedback, the questions are, who are the peers, and how do you report back sensitive information to a faculty? And is the session that you're actually observing, is it modified by the fact that it's being observed? Other things include instructor reflections, such as teaching philosophy, documentation of participating in discussions, hopefully more and more such as these, and talking to colleagues about innovative and inclusive teaching, and describing their pedagogical strategies, as well as teaching portfolios. So to end, what is the role of public health in assessing teaching effectiveness? And so we kind of really thought about this a lot, and the more I thought about it, I thought, well, we should be very well equipped to do this. We have the theoretical and methodological expertise to do this. For my social and behavioral science colleagues, if you think of interventions, you can think of teaching as an intervention. So we have a lot of skill sets to develop theory-based interventions and to assess them. So how might we do that? And also, I think this is a prime time, as most of the programs, schools and programs go through revamping of their curricula to align themselves with CEIF criteria. This is a good time to kind of start looking at assessments overall, but also assessments of teaching effectiveness. And lastly, I want to say, we've heard a lot about teaching centers across universities in this country and probably in other countries as well. And it just heartens me to know that more and more I hear about centers and offices dedicated to teaching and learning located within schools of public health that actually address teaching and learning from a public health perspective. And so I feel like we can really address more faculty support. We've talked a little bit about that today, but probably not as much. How do we as faculty who come from a whole other teaching model come and we're expected to do these great things that we're learning about today without some level of support from individuals who are knowledgeable about public health training and education, as well as moving forward the scholarship of teaching and training, which is why it's so amazing that we get to be here today and do that. So thank you very much.
I graduated from the University of Michigan School of Public Health in 1977, having spent a semester at Harvard also, and we never talked about structural racism. It's a rather remarkable thing to see how teaching in public health has evolved and improved. So you were the barrier for lunch, and now it's the questions, and we're ready to entertain and answer. Please.
I've got a couple of questions, but I don't want to delay lunch so much, so I don't know how to deal with that. First, for Wayne, I want to congratulate you for being one of the few people, or maybe one of the only people that I know that is also doing things that I'm doing that has to do with developing multimedia ways of doing it. We need to talk about how what I've done and what you've done, how we can merge them or work with them somehow together. So that's the first thing. And the second thing for Delia, about your report, you didn't. We talked about this last night about evaluating faculty for promotion. I mean, there's an issue of evaluating students, faculty for how they're teaching a course and what student evaluation, but how to evaluate faculty for promotion is an issue that we've spent a lot of time at Emory talking about that and putting together ways of doing that. And the key point is that if you're evaluating a faculty member for promotion, it shouldn't be on how they teach a particular class. It should be how they deal with a whole bunch of different dimensions of what teaching is all about. Not just teaching a class, whether they write textbooks, whether they give short courses, whether they write papers about teaching and all of that stuff. So there's an issue about faculty evaluation that needs to be addressed by a lot of different schools of public health. I don't know if either one of you want to comment.
Yeah, I agree, and I think that's the multidimensional part of this whole issue, because I think traditionally student ratings or student evaluations, student assessments, whatever you call them, were primarily used to indicate how effective a teacher was in the course. And we know more and more now that there are multiple factors that go into those evaluations that may not actually address what we want to address. So measuring teaching effectiveness, measuring learning outcomes is challenging. And we need to look at some of those other ways in which we can bring different factors into informing those decisions, because they're kind of important, the promotion ones, I mean.
Thank you very much. I'm Richard Lang in the School of Global Health and Department of BU School of Public Health. What Professor Evans spoke about as far as the TA was concerned, I was very pleased to hear that discussion because it's often not discussed, and particularly the important role of experienced faculty in building up the capabilities of teaching assistants, not just as filling a space, but bringing them on as future academics. And my question is, in many places I've seen a quota system for TAs, that if you don't have more than 20 or 40 or 35 students in a class, you don't get a TA. And yet for the TA, the learning process in being in a small class may be much stronger than just marking a lot of scripts and being available for answering students. In a small class, you can get the TA to participate in building the class and developing the class. And I'd like your comments on, should we have TAs in small classes for their benefit?
Oh, I agree entirely. I think what it comes down to is what resources the college has to employ TAs. And I think what happens so often is that those resources are limited and they end up putting them in the large classes because they think that, you know, this will break up the workload of the professor in that class. But I agree entirely with you. I think we need to focus much more on what is the advantage to the TA. And I think that that needs to be increasingly more important than just that TA, what benefits that TA can make to the professor.
Other questions, yes.
I'll try and be quick, recognizing lunch is just 4 minutes away. Seth Eckhouse, Boston University School of Public Health. A question on evaluation. What do you believe is the utilization, the proper utilization of tools such as Kirkpatrick or other tools that are out there? Do you think that that has a place for it? Is it too labor intensive? What's the cost-benefit ratio?
Yeah, so some of the tools that there are some data to suggest that they're reliable in their use. If you look at them, they're really, really very extensive. They're very lengthy and very cumbersome to use in a classroom setting that allows a certain number of minutes or relies on students to do them outside of the classroom. And so I think we see some of the response rates drop as we make some of those measures more intensive for students. I think we've seen response rates drop as we've moved from paper and pencil in the classroom to electronic versions. And then the question is, if the response rates drops, we have a whole slew of other issues in terms of interpreting the results. So, yeah, I think that's a challenge.